Do you have the visceral fat of a wheat belly? Let me tell you what that means. Visceral fat is the fat mostly in the abdomen that surrounds the abdominal organs, like the liver, the spleen, the kidneys, and line the intestinal tract also. And this fat's highly inflammatory as compared to subcutaneous fat. That's fat in the layers of the skin that provides warmth and doesn't seem to be anywhere near as damaging to overall health as visceral fat. It's not entirely clear why visceral fat is such a different thing than subcutaneous fat, but it's clear that people who have visceral fat are at much greater risk for cancer, high blood pressure, type 2 diabetes, insulin resistance, heart disease, dementia. In other words, that visceral fat is not just a cosmetic issue, it's a real serious health issue, and it's quite common. If we were to biopsy that visceral fat and look at it under a microscope, you would see that's filled with white blood cells, kind of like pus. It's all inflamed. It has inflammatory white blood cells. And those the fat cells and the inflammatory cells are producing inflammatory factors that gain access to the bloodstream and further increase inflammation body-wide. So visceral fat can lead to inflammation in the heart, can lead to inflammation in the arteries, in the brain, other parts of the body. And that's why the visceral fat is not just a problem of appearance or a big tummy, it's a body-wide problem. Recall, for instance, that a big driver of dementia risk and heart disease and cancer is inflammation, and visceral fat is inflamed. Now, you really can't see visceral fat because it's deep inside the abdomen, but typically it's expressed as a protuberant abdomen and or the kind of spare tire look, the love handles, as some people call it. Even though that itself is not visceral fat, that is highly indicative that you have visceral fat inside, deeper inside. So having that kind of pattern, the spare tire, love handles, protuberant belly, is highly suggestive of having abundant quantities of visceral fat. So why do people get visceral fat? Well, because we've been overexposed to the amylopectins of grains, wheat and related grains, and sugars. And those foods dramatically increase insulin. And that sets in motion a series of responses that causes visceral fat to grow. Once visceral fat gains a foothold in your body, it tends to do things that makes it grow. Because visceral fat's inflammatory, it further blocks insulin, it causes your triglyceride blood level to go higher, and other effects, all of which make insulin resistance even worse, make your blood insulin go higher, and make visceral fat get worse. In other words, visceral fat sets in motion a vicious cycle that makes visceral fat get worse and worse and worse. So it's very important, if you've got visceral fat, to stop this. You start by removing the original cause, which is grains and sugars. And most people are shocked at how quickly the visceral fat, or what I call a wheat belly, because it comes from wheat and other grains largely, will recede. Now, there's more you can do to accelerate and go further in improvement in reducing visceral fat. And these are all the components of the wheat belly and now the undoctored program. These are factors like normalize your vitamin D level and cultivate healthy bowel flora and supplement magnesium because it's been taken out of your drinking water. And make sure you get iodine and normalize your thyroid status. So all the basic components of the undoctored, wild, naked, unwashed program, a lot of things they talk about in Wheat Belly Total Health book, a lot of the strategies we deliver in a kind of an encapsulated, get it done quickly program and the Wheat Belly 10-day grain detox. These are all the strategies we use to reduce or remove or minimize visceral fat.